Hello everyone, my name is Bishara Ram and I'm an advanced paramedic. I'll be presenting to you today about first aid for medical emergencies. This presentation is part of We Always Learn initiative. We Always Learn initiative is an Emirati initiative that aims to spread knowledge all over the world through providing workshops and courses on different subjects. The aim of this presentation is to identify proper procedures for several medical emergencies and to assist in providing care for someone who's injured. Let's all be prepared to save a life. The most important thing when it comes to learning first aid is to understand the 3 C's. What are the 3 C's of first aid? The first C is to check. This is the most important part and it should be done first before anything. It involves checking the person and the surrounding situation. Ask yourself, is there any continuing danger, including people, weapons, traffic, fire, and so on? Then turn your attention to the person. Is he moving? Bleeding? Call the injured person and see what kind of response you get. Keep checking his level of responsiveness as you get close enough to touch him. Remember, your safety first. Do not attempt to provide care for someone if there is any threat to your personal safety. Then comes the second C, which stands for call. Based on your assessment so far, you should now be able to decide what kind of help you actually need. For example, you might need to call for police or fire department assistance before calling for an ambulance. Then comes the third C, which stands for care. This is the treatment part. You don't need to provide an optimal level of care or the highest quality of care to the victim. But what you actually do here is to provide the needed treatment to someone until the arrival of the emergency medical professional. And this is the meaning of first aid, is to help a sick or an injured person until professional medical treatment is available. The 4 basic rules. Every medical emergency is different, but there are 4 basic rules that apply to all medical emergencies. The first rule is to call for medical help immediately. For example, if someone collapsed in front of you, let someone else call for help while you care for the victim. If you're the one making the call, explain the kind of injury and where the victim is located. The second rule is to bring help to the victim. Do not bring the victim to help. In other words, victims should not be moved unless there is a reason that is behind your control. Then comes the third rule, which is to check the CAB or CAB. C stands for circulation, A stands for airway, and B stands for breathing. This basically means making sure that the victim has a pulse, the throat is clear, and the victim is breathing. If the victim is not breathing and has no pulse, you will need to perform chest compressions. And finally, do no further harm. Be careful not to cause additional injuries in your attempt to help a victim. Know what you're doing. If, for example, you don't know how to deal with burns or broken bones, you may cause more damage to the underlying skin tissues. That's why, if you're not sure what you're doing, call for help and let the emergency dispatcher guide you until the arrival of an ambulance. Heart attack. A heart attack occurs when an artery supplying your heart with the blood and oxygen becomes blocked. This could be caused by the buildup of fat over time, causing a blood clot, which eventually stops the blood supply to the muscle of the heart. This is a life-threatening condition that requires an immediate emergency care. True or false? All heart attacks start with severe chest pain. False. Symptoms of a heart attack may start as mild discomfort in the chest. A person may not experience any chest pain at all but have other symptoms. Not all people who have heart attacks have the same symptoms or have the same severity of symptoms. Some people might have mild pain, while others might have more severe pain. The most common signs and symptoms of heart attack include pain or discomfort in the chest, lightheadedness, nausea or vomiting, jaw, neck or back pain, discomfort or pain in the arm or shoulder, and shortness of breath. Management of heart attack. Call for emergency help straight away and tell them you think someone is having a heart attack. Help move the patient into a comfortable position. The best position is on the floor with their knees bent and their head and shoulders supported. You could place cushions behind them or under their knees. Give them one aspirin tablet, 300 mg, and ask them to chew it slowly. Aspirin is a blood thinner medicine that helps with the blood circulation. Do not give aspirin if the patient is under 16 or allergic to it. Ask the patient if he has a history of a heart problem and has his own medications. You can help him take his own medications. Keep monitoring his level of response until emergency help arrives. If the patient becomes unresponsive at any point, prepare to start CPR. Cardiac arrest. A cardiac arrest happens when the heart stops beating. If someone becomes unresponsive and is not breathing, he is in cardiac arrest and you need to act quickly. Call for emergency help as soon as possible and start CPR. CPR stands for cardiopulmonary resuscitation, and it's a life-saving technique that aims to keep blood and oxygen flowing through the body when a person's heart has stopped. CPR performed within the first 6 minutes from the moment the heart stops beating can keep someone alive. So how to place your hands to do CPR? Place the heel of one of your hands in the center of the chest, between the nipples. Put your other hand on top of the first and interlock your fingers. Push straight down on the chest for at least 2 inches. True or false? Cardiac arrest only happens to the elderly or to people with a history of heart problems. False. Although there are people who are at high risk of having heart problems, cardiac arrest can happen suddenly to anyone, young or old, male or female, anywhere, at any time. Management of cardiac arrest. If a person is unresponsive and is not breathing, shout for help. Ask a helper to call for an ambulance while you start CPR. If you are on your own, use the hands-free speaker on a phone so you can start CPR while speaking to the emergency dispatcher. Before you start CPR, use a towel or piece of clothing and lay it over the patient's mouth and nose. This is in order to prevent yourself from any infection. Start performing CPR. Keep your arms straight and lean over the patient. Press down hard to a depth of about 2 inches. Continue to perform CPR until emergency help arrives and takes over, or until the person starts showing signs of life and starts to breathe normally. If the person shows signs of becoming responsive, such as coughing, opening the eyes, speaking, or starts to breathe normally, put him in the recovery position. Recovery position, as shown here in the last picture, is where you roll the patient on his lateral side towards you in order to maintain an open and clear airway. Remember, you can save a life from sudden cardiac arrest. Every second counts. Thank you, and see you in the next part of this presentation.